on from Rocky. Thanks for that feedback, Matt. Thank you. Okay. So welcome to this Men's Health chat for Men's Health Week, the fifth and final session this week. If you haven't been here, we've covered prostate cancer, stroke. We've looked at men's health facts. We had Ask a Pharmacist yesterday. That was an eye-opening question. We challenged all the attendants to see if they could shock the pharmacist with the questions they've asked, and they couldn't. He'd heard it all before, and he had some great answers. And another unshockable man joining us today is Jonathan Bedloe. We've saved the best tool last, but I'll introduce him shortly. I would like to start by acknowledging the traditional owners of the land where we meet from today, all around the country. As ever, I'm joining you from the Tarablang lands of the Tarablang Bunda, the Gureng, the Gurang, and the Bailai peoples up here in central Queensland. And I'd like to pay my respects to elders past, present, and emerging. If you want to share where you're coming from, the town, the state, the traditional land, just pop it there in the chat box. So today we've got to focus. There's been a lot of focus on what we can do to take care of our health this week, and rightly so. But today it's just a slight shift because it's a focus on how can we look out for each other. In particular, how can we look out for our mates? And we have an absolute legend and expert to take us through this conversation. Jonathan Bedloe has been in and around the men's health sector for at least 20 years, I'm sure. I know I first met him at a national men's health gathering way back in 2013. Been doing great stuff in Tasmania for many years. I was for many years a member of the Australian Men's Health Forum board. Has been involved setting up many different projects, establishing men's sheds, and particularly known for his sterling and ongoing work with Men's Resources Tasmania down in Tassie. Jonathan's also highly skilled and trained in the world of mental health first aid and suicide prevention, and travels around the country training people on suicide intervention. And he's got a particular passion for how we engage men in those conversations, and has worked with us very closely to develop resources that are specifically targeted towards conversations with men. And it's one of those resources that he's sharing today. I'll say no more. I will hand you over to our expert, my friend, the wonderful man, Jonathan Bedloe.
Thanks, Glenn. I guess it's good afternoon, everybody. Great to see so many folks here from around the country. And it's great to be participating in another Men's Health Week with the Australian Men's Health Forum. I'm dialing in from Mamaramina People's Country, Oyster Bay Tribe, down here in the southeast of Tassie, where it is actually sunny today. I'm sorry for all you people up in those cold climates up in Queensland. Oh, it's terrible. Proud to say I've been in the water this morning, had a swim in the sea. Yeah. So yes, I'm going to just pop up my screen so I can share a resource that we created a couple of years ago, focusing on how to help a mate. And I really like this focus because I think I'd love to see your comments about this too. But when we're struggling, when we're having a hard time, I think that's the hardest time to reach out. We hear that message all the time, and it's an okay message, nothing wrong with it. We should reach out if we can, but I think it's actually a really tough thing to do. And so this approach of looking out for our mates, helping each other to figure out how can we reach in and tap a mate on the shoulder and say, hey, how are you actually going? So that's the focus of the conversation. And love to hear your input, see your comments in the chat. Currently, I can't see the chat, so I'll try and configure my screen so I can whilst we're chatting. But certainly chime in, Glenn, if there's anything you want to contribute. Okay. So, first things first, we want to acknowledge that uh, in any of these conversations, there'll be people in the space who have been impacted in some way by suicide, whether that be their own suicidal thinking and attempts, or whether it be bereaved, having lost someone close, or supporting somebody else who's made attempts or had those thoughts. So just, yeah, I want to encourage everyone to do what you need to do to look after yourself. If you decide it's not for today, this conversation for you, then, maybe just drop us a note in the chat to say you're okay and bail out. Um, or if you want to be able to have a chat to someone, stick a note in the chat to Glenn or Kim, and we're happy to connect you with some other resources. I'm sure everybody knows all the usual support lines: Lifeline, Men's Line, Suicide Callback Service, and the like. Um, so, what are we going to talk about? We're going to step through these 5 areas. We're going to have a quick chat about spotting the signs. Um, Often we get the sense that it's hard to see the signs, and we often hear when tragedies happen in sort of public spaces with footy personalities and the like. We often hear people say we just couldn't see, there was no signs. Well, we need to learn about the signs, so we'll put a few minutes into that. Then we'll step through how do we actually have the conversation. It can feel nerve-wracking sometimes to step into a conversation about suicide or even just checking in with someone. So we'll give a few hints and tips about that. We've got a great simple model that you may well have come across other models from Are You OK or mental health first aid training. They're all pretty similar. So we've sort of stolen the best of those and put it in our language. And then actually addressing the question of suicide, obviously, and how can we then connect people to help. All right. So let's start off by focusing on those signs. So I'd love to get a sense from all of you if you can tap a couple of things into the chat. I have got visibility now. I've managed to work my technology. Um, what are some of the signs that a mate might be doing it tough? We like to think sometimes of things in different spaces. Things have changed. Things don't feel right. And situations and contexts. So, yep, withdrawal, that's a really good one. And this is what I was saying, people find it hard to reach out when they're really struggling. They tend to withdraw. So let's really pick up on that. That's a key one. Isolation. People go quiet when they normally talk. So when their behavior changes, yeah, they're not who they usually are. They're normally outgoing, effervescent, and all the rest of it. And all of a sudden they're isolating and withdrawn. Or maybe they're normally quiet and down, and maybe they've been having a tough time for a long time. If they're suddenly resolved and there's a change in their demeanor and they seem to have a resolution, maybe that's even a bit of a sign as well. Great. So risk-taking behavior, another good one to point out. Thanks, everybody. So there's a few of the warning signs. We might hear some words as well. Things like, I've found a solution, or I'm just a burden. I'm just in everybody's way. People would be better off without me. Some of those sorts of words, subtle hints, we should pick up on those and lean in and inquire. Okay, so all of that can be kind of summed up, if I can just get through to the next slide, in something's happened, something's changed, something's not right. So in that first one, situational changes, and this is what we, Glenn and I and others have been really trying to draw some attention to in our national policy level discussions, is that it's not just a mental health issue. It may be, But there's all these other situational factors that may be going on, big life changes and events, relationship issues, workplace-based stresses, retirement, redundancy, financial stress, alcohol and other drugs, uh, those life events that may happen. Something's changed. So that change in behavior, and it could be from good to bad or even bad to good in a sense. Using alcohol or other drugs in increasing levels, not enjoying life, the withdrawal and isolation that you've all mentioned. And then something's not right. And I think this is a really useful thing for us as mates, as people concerned about our family members, our brothers, our dads. Um, Something's just not right. We've got that gut sense, and we are very perceptive beings. We've got incredible neurological senses, and we're highly attuned, and we may not even understand what it is that's making things not feel right. And I reckon let's lean into that feeling. Um, Maybe it's the lack of self-care that's happening. Maybe that feeling of hopelessness that we're picking up somehow. Let's make a note of those things and lean into the conversation. So you get to that point where you think, yep, something's happened, something's changed, something doesn't feel right. Maybe my mate needs some help. Um, and it may be that there's two or three different things we've picked up on. That's enough. We don't have to know everything about what's going on to get that sense that leaning into the conversation and checking in with the person would be a good idea. But before we do that, before we work through how we're going to have that conversation, here's a bit of a background map for the conversation. We're going to talk through this in a moment, but it starts with the ABC, asking and listening. So asking good questions. And that's kind of the way into the conversation in many ways. Asking good questions, and then building a plan together. Again, we don't have to fix things. As a mate leaning into these conversations, it's not our job to fix the problems. We don't have to resolve things for our mate. That's actually not what they want from us. They want to be heard. So let's ask and listen, and then lean into building a plan together. People, men particularly, tend to have solutions to the problems they're facing. They know the full picture. They just need us to ask some good questions around that and to build that plan with them. And then, if needs be, we can connect them to some other help and support. So again, before we actually step into that, let's step back for a moment and check in with ourselves. How are we traveling? This is potentially an important conversation. We want to be in a good headspace ourselves and, hopefully not trying to grapple with too many of our own challenges. So let's just check in with ourselves, make sure we're traveling okay. We want to find a time where we can have that chat and we're not going to be interrupted. Maybe we're not on the booze and under the influence of, a losing of inhibitions. That might be the time, but it's probably not the best time if we can find another one. Maybe it's about finding a time to go for a walk, using those shoulder to shoulder principles that we've probably heard about earlier in the week and we're familiar with from the men's shed movement. We know that guys relate really well shoulder to shoulder, sort of putting the problems out in front of them rather than between each other, more like a counseling situation. And maybe just make a few notes around what is it you're going to say? What is it that's motivating you to want to have this conversation? What are those things that you've noticed, the signs, the warning signs? What is it that's changed? What's that gut feeling you've got? Because that's probably the way into the conversation. So if we're happy to lean in and have a go, we're going to start with that asking and listening. So let's assume we've got a few of the niceties out of the way, the how are you going, how's the footy team, all of those things. And we actually want to lean into this conversation and start checking in a bit more of a serious way with our mate. What would be some opening statements? Chuck another couple of thoughts in the chat if you can. Test your typing skills. And yeah, what would be a few words that you might start the conversation with, do you think? Are you okay? Yep. It's a phrase rather, that we're all familiar with. Um, and sometimes I think we're nervous about the response we might get. Um, but that's good. We're leaning into the conversation. Beautiful. Love you, mate. But it seems like things aren't how they usually are. How you going? Yeah. So we're noticing something's changed. I've noticed things aren't quite right. I'm here for you. Fantastic. Great couple of responses. I've noticed you've been leaving the smoko table early. So this is, these are our experiences. These are the things we've noticed. And in a sense, they're not really up for challenge because they're our observations and our understandings. So some other examples we've got in the book, and I should make the point that we've got a resource that sort of captures this conversation. There it is. Look at it. Thank you, Glenn, for having the book on hand. It's just been done up in a new brand, so that's looking good. Um, so yeah, sounds like you're doing it tough. What's going on? I've noticed these things. I know recently you had a relationship breakdown. You don't seem like your usual self. What's happening for you? Yep. I'm listening. Keep going. Tell me more. So I think sharing particularly the things that we've noticed, the reasons that we are having this conversation. I've noticed you're not your usual self. You haven't been showing up to hockey practice the last few sessions. I know since your wife passed away, you've been spending a lot of time on your own. I'm really worried. How you going? So good open questions. What's happening for you? Tell me what's happening. Getting people, getting them to open up. And the next part of that is, of course, to listen. Okay. It's so easy to dive into these conversations and actually have the conversation ourselves, and to fill the person's responses. But let's actually practice that active listening, the use of silence. Sometimes when we get asked deeper questions like this, a little bit more time, a little bit more space to actually allow the answer to land, and to come out is important. I should be scrolling my screen. There we go. So, top tips in asking and listening. There's a reason you want to talk to him. Let's name it up. It's a great way to enter the conversation. Open questions rather than yes or no questions. So, open questions, often the best ones begin with the word what or how, um, uh, and that they create an expansive conversation. Closed questions tend to bring out a yes or no answer, and there's a place for that. But at the moment, we want to try and get the conversation going and get this mate of ours opening up. So listening like a pro, don't jump in, try not to judge. Yep. And try not to fix. So as I was saying, people often we think we need to fix people. And it's well intentioned. We think we got all the answers, and we probably have got lots of great answers. But it's much better if people can be empowered to find their own answers and to be validated with where they're at. The validation, the acknowledgement that, yep, they're having a tough time and it's understandable. Um, that's really powerful. Anything you want to throw in there, Glenn, on the top tips and covering off on A for ask and listen?
No, I think you've got, I think the big thing is one of the things that prevents us from having the question is that we don't know what to say. We feel responsible. And I
Mm,
think one of the messages we really want to get across is this is about them, not you. And there's massive value in being given the space just to get stuff off your shoulders.
yeah.
So the skill here is not knowing the answers. The skill here is actually just listening. And actually, the
Mm,
skill is sort of setting aside that voice that wants to jump in and sort of go, oh, well, it could be worse, or or "Oh, you should do this, or to just jump in and sort of say, oh, I've been through that as well, and tell your story. Developing the ability to ask and then listen and listen intently, it's so powerful. And it really breaks down the myth that men don't talk because we've got so much experience of when actually when you ask and listen, men will offload and tell their story.
exactly. Thanks for that. And, there's very strong evidence to show that when we do that, um, people are already safer.
Mm.
The mates we're worried about in these conversations, they're already safer because you're there, you're present, and you're engaged. And in that sense, we don't need to fix anything, even if we think we need to. We don't. We've already done it. We've created that safety. Now, there may be some situations where there is some other imminent risk. The person's already done something to initiate a plan. And of course, that would activate an emergency response when we become aware of that. But let's carry on the conversation for the moment, knowing that we're engaged, we're connected, we've asked some good open questions, and the person's starting to open up. It might be a bit awkward for them, but you're finding your way in. So uh, the next action is about building a plan. And it really is about building a plan together. I think we almost could add that word in here because it's not our plan. Yeah, it's not up to us to find those solutions, as we've been saying. So it's kind of more questions, really. What does this look like? Where do you think we should go from here? So, love to hear or see some comments from the floor. What would you put in the comment here to say what would you ask? What sorts of comments might you say at this point in trying to elicit a plan with your mate? What sorts of things could you say? Thinking about those good open questions. Yep. So great comment there from Mark. We um, might come to. I'll let Glenn select questions for later on, but we'll certainly be happy to have a bit more of a chat maybe towards the end of the session. Um, all right, let's go through to the next slide. So, what
Got
to
a couple of
say?
suggestions there now,
Yep.
Jonathan.
Okay.
So what would be helpful for you now? Have you thought about getting some help?
Ah,
How can I help you? How can I help you do something about that?
yeah. Sorry, I've just to note, I've got a private comment from Mark Woods. I didn't realize it was private. Mark, could you send that through to Glenn, please, or to Kim, so we can connect with you about that situation? All right, back on track. I've noticed some things have changed. Just wanted to talk to you about that. Yep. Um, Also, something to note about ask and listen. Men get tarred with the brush of being inattentive, rightly or wrongly. So us blokes need to be really in tune, be present, take notice of the signs. Goes back to the point of creating the space. That's right. So, you know, in a sense, we've got two ears and one mouth. let's do twice as much listening as we do talking. And when we do talk, try to keep it short, ask some good questions. So here we go. How can I help you do something about that? Great. What help can I be? So we're offering help, but we're not telling them what that might look like. Have you thought about getting some help? Great, because maybe they haven't, right? It can be that simple. And just asking that question it makes it okay. Yeah, it starts to destigmatize the idea that it actually might be okay to reach out for help. What's it going to take for me to get you through this tough time? Yeah. And that's great. And I'd say we could even refine that a little bit. I'm getting picky here, very picky. What's it going to take for us to get through this tough time? Because it's not for me to get them through this tough time. It's kind of that for them. It's up to them to get through this tough time, and we're saying we're happy to help. Yeah, subtle differences. Getting picky. Awesome. So great. Couple of examples there on the slide, as you can see. A few other thoughts. What do you want to do about this? Or what do you want to do about this? What can you focus on? What can we focus on for now? What's one thing we could do today? And if we do, sometimes this is a point at which our own experience may well come up. And I want to say, let's not rule out sharing our experience, but let's keep it short and sweet if we're going to share that. Um, our lived experience is valid. So we might say something like, I had this tough time a few years ago with this situation. This was an organization I had a chat to. What do you think about that? Would they be right for you? Or if not, who do you think would be helpful? Oops. A few more tips there on the screen. So, yeah, we're moving from what's up to what now. And this is often where, a lot of people like to step into is, particularly guys, is action. They want to take some action. Yeah. Um, the focus on the feelings isn't necessarily a bad thing, but for a lot of guys, it's less about feelings. It's more about the situation. So, what can we do to actually change the situation in some small way? Remember, it's not our job to provide solutions. Uh, my view is people just need to be asked the right questions to find their own solutions. And if they do identify their own solutions, they're more likely to remember them and more likely to enact them because they've come from themselves. Great. Any other comments that have stood out there or questions on how we might build a plan? I guess just to say, what's the plan for? In a sense, if we're talking about a suicidal crisis, we're looking at staying safe for the next 12 to 24 hours, and we could actually have some quite clear actions that we might want to take to maintain safety for the next 12 to 24 hours, essentially making sure they're not left alone. Um, but maybe it's not a suicidal crisis. Maybe it's just, there's just an awful lot going on. There's overwhelm, there's isolation, there's fear around where to go, how to get help. And maybe there's a few more questions around all the different resources that might be available, other people that he can lean on and the like. Great. How can I help you do something about that? It's a great point to finish up that section. So our third action is around connecting to help. Um, so what's this about? And what would you say to help connect this mate of ours to the help he needs? Love to get a few more comments if we can. This can take a lot of different forms. Um, Suicide for a long time has been seen as a mental health issue, and uh, it may be in the background, and it may actually be beyond that, or something different. It might be those work situations, the financial stress, the relationship challenges, the alcohol or other drug situations. And so, in that sense, we want to think broadly about the type of help. There may be mental health challenges that are going on, but they're not actually the front of mind thing for this guy. It might be those other situational factors that are the main cause of the stress. So, campfire, connecting with some mates around a campfire. I mean, in a way, I think this is a really good preventative thing, right? If we're engaged with a bunch of mates, uh, that that helps to build those connections before things get into crisis situations, and gives us those supports that we might need when things then turn more difficult. It's a good way to have the conversation. You're absolutely right, and in a sense, it fits with that side by side narrative as well. That guys like to connect side by side, having the fire as a focus. It's like we can throw our problems into the fire and talk about them in there. It kind of takes away the eye contact. There might be other times and ways to have eye contact that might be helpful. It's not necessarily always needed. All right, let's go to the next slide. So, connect to help. So, we might offer our own help. Would you be up for me checking in with you next week or tomorrow? Um, who else would you like to talk to? Is there somebody else that you trust, that you feel comfortable sharing these things? Do you feel comfortable sharing this stuff with your partner? Have you shared this with your GP? Um, have you talked to the EAP at work, the Employee Assistance Program? Have you used Lifeline? You know, um, have you called up Men's Line? Why don't we give them a call today? Now, let's just see what they offer. Um, we don't have to be in crisis to call these lines. Um, let's try some of these things out. If we know of services or individuals that have provided a good service, um, recommend them. That warm referral is a powerful thing amongst men. Trust is an issue with a lot of services, and unfortunately, there are a lot of services that aren't as good as they could be at reaching men. We know up to 4 out of 5 up to 4 out of 5 recipients of suicide prevention services are women. So we're doing a great job of reaching women. And part of what AMHF is trying to do is sort of suggest some different approaches to help those services think differently about how they engage men. So if we've got a good referral, we've got a recommendation, we should definitely make it. It's a powerful thing, and it builds on that trust that we might have with that person. Good question there about getting access to copies of the booklets. We'll cover that at the end and see what's available in that space. So a few more of those top tips. Yep, GPs obviously are still important. And even if the main issue isn't about mental health, it's about relationships or work stress, it may not be a bad idea to check in with the GP, because those situations may be adding to anxiety or depression in the background. And the earlier we can uh, get those things checked out and engage with professionals about that stuff, the better the outcomes for sure. So, what is it he wants a hand with? What is the main source of stress anxiety, fear, um, the suicidal thinking, stress, money, family, booze, whatever it might be. Um, so thinking broadly, trying to think about those local services. Um, if you're not sure of services, if you don't know where to find services, it's not something you're familiar with, there's a number of different websites that you can access. Um, if you're in New South Wales, the Australian Men's Health Forum partnered with Suicide Prevention Australia to put together the Doing It Tough website, which is not bad. Even if you're not in New South Wales, it'll certainly give you some good hints and tips about some of the broader services that are out there. Lots of grassroots men's organisations. Obviously, the locations are only focused on New South Wales, but many of them do have a national footprint. Lifeline also have an excellent service directory. And there's another one, I believe it's called Ask Izzy. Ask Izzy, IZZY. That's a national sort of search engine specifically with social services contacts and the like. Um, Again, if we can make recommendations to what we would call as male-friendly services, services that are good at working with men, maybe have some male practitioners. Not everybody needs a male practitioner, but some men do prefer that, depending on what the topic is. So, having some knowledge around that would be helpful. And even if you haven't agreed to, let's check in. Check in again the next day or the next week. Um, you don't have to have made that promise to then just follow up and check in with your mate a few days later, see how things are doing. Has he followed through? Has he actually sought some help? Has he connected in with some other forms of professional help? Maybe not. Sometimes it's easy to procrastinate. It's easy to think she'll be right. I'll feel better tomorrow. So all the more reason for us to check in and see if things have changed, if they've connected in with some other services, and encourage them to continue to seek help, because there is also strong evidence that shows when people are encouraged to seek help from friends and family and trusted people, they are more likely to do so. All right. So that's the ABC. Um, what we'd like to do now is just briefly touch in on if it really is a suicidal situation. The man's struggling. He's named it up, or it's got to a point where you really are worried about his safety. Maybe it's already come up in the conversation. Should we talk about suicide? Should we ask? And we would say absolutely. Um, there's a bit of a myth or a fear out there in the community that if we ask someone about suicide and they haven't been thinking about it, that we might put the idea in their head. Well, the evidence is very clear that's not the case. We're not going to increase the risk of suicide to somebody who hasn't been thinking about it. So we can lean into that conversation without fear or worry that we're putting bad ideas in people's minds. So, how could we ask this question? Um, Really, it's about being direct. Uh, there's lots of ways to ask the question, but it's best practice, we would say, to make sure we're using the words suicide, ending your life, killing yourself. One of those three options. A lot of people suggest with young people that we actually use very specific words of killing yourself because suicide is potentially jargonistic language. But the point is, we want to be clear in what we're asking. Um, if we come at it in a way of saying, you're not going to do something stupid, are you? that can feel like we're making connection. It can feel like we're talking the same language, but in a sense, it's not as clear and direct as it could be. So we really want to be upfront and say, hey, you say you're having a tough time. It sounds pretty tough. I can't imagine how you're going. Sometimes people in these situations think about suicide. Are you having thoughts of suicide?
I also remember one story of a fella who attempted, and he said, lots of people have said to me, "You're not thinking of doing anything stupid, are you?" And I said, "No." And I wasn't lying because at the time I knew what I was going to do, but to me, it wasn't stupid.
Exactly. It's a solution to a problem, and this is how particularly men think about these things. It's a situation where they're feeling deep pain and distress, but it's a set of problems, and they want to resolve the problem. And one solution to that is to end their life. Um, and there's very clear evidence that this does happen from suicide reporting data and the like. And so this is why we want to be upfront with our question and clear in what we're asking. And it also means when they give us an answer, we know what they're talking about, which means we're in a better position to provide real and meaningful support. So I'd love to just put it out there quickly. How does that question feel to you? Couple of comments. How do you feel about asking that question? Does it feel okay? Does it feel tough? Does it feel awkward? Are you nervous about asking that sort of question? So no comments in reply, but I guess um, yeah,
Apprehensive.
apprehensive. Yeah, feels scary. Great. And look, totally understandable. That's great. Sangeetha feels it's not so scary, but lots of people do feel nervous about it. And I think let's acknowledge that. Yeah, it can feel nerve-wracking. We're worried about what if they say yes. And I would say let's step back to the ABCs. We can go back to the start of the ABCs, just keep asking some questions and work together to build that plan. We don't have to fix this. If anything, you've already taken a massive step in helping to create some safety around this man. Yeah.
Yeah.
So if we can step into this space and be comfortable with being uncomfortable, um, it's probably not as uncomfortable as how they're feeling.
Can I just chuck one in here, Jonathan? Because well,
Please.
there's two actually. I'm going to respond to the first one, but I'll hand over the second one to you.
Mm.
And someone said, and it's a really good point. It's a big jump from how you're going to are you thinking of killing yourself? Um, and of course, when you put it like that, it absolutely is. And we're not saying that you should be asking this question in every situation. However, if you've opened up the conversation because of all the concerns you've noticed all these changes and that they're doing it tough, and then through the process of that conversation, you've got concerns because you're in that world and that conversation. There are very light ways to ask in a very matter of fact kind of way. So people have different approaches. This one is my personal favorite, which should be something like. Gee, you've told me all this stuff about what's going on with, your relationship, your wife, the kids. That's a lot of stuff you're dealing with. You know, it's really not uncommon for men in your position to think about suicide. Have you been thinking about suicide? And so it's a very normalizing way to say something when you actually reference the fact that you're not the first person. Many other men have been in your situation, and many in your situation have actually gone down this path. So there's a way to bridge from how you're going to are you
Mm.
thinking of killing yourself? Now, I hope that's useful. Another person said tough, which it is, especially if you've never done it before, and then said, "This is for you, Jonathan." And nervous on the answer. So not mu so much the concern about the asking. It's
Mm,
more about, well, what if they say yes, or
yeah,
what am I going to do when they respond? So how do we
yeah,
deal with that?
yep, absolutely. And it's again, let's acknowledge it. It's an understandable concern and worry. Um, Again, I would say you've already made them safer by just being there and being listened by listening. My response, if somebody said, "Yep, I am," my response would be as simple as something like, "Wow, that's really tough. I'm sorry to hear that. Thanks for sharing that with me. I'm so glad you've told me because now, I'm here. I'm here with you. I'm here for you. Let's work through this together." Yep. We don't have to fix it. We can't fix it. Um, but presence, engagement, connection, that is what they need. And that's what we're offering. It's pretty much all we're offering. We might offer some more in terms of connecting them to services, but you don't have to fix it. Just be there, just listen and accept them and acknowledge them where they're at because that's what they're looking for. They're looking for acknowledgement that the situation they're in is crap. And it probably is. So uh, it's from there you can work together to find a plan. Wow, this feels really tough. I'm not quite sure what to do, I'm really worried for you though, but I'm so glad you told me. I'm so glad you told me. I feel like we should tell someone else. Yeah, I feel a lot of responsibility. I want to make sure you can get through this. I feel like we need to connect with a few other people. Who else can we tell? Yeah.
Yeah.
I love that honesty in the conversation. We can declare our own vulnerability, our own feelings of feeling insecure or nervous about this. It's normalizing, it's giving them permission to stay vulnerable. Yeah, fantastic.
Right. Thank you for the way you handled that conversation and that question, Jonathan. And I
Mm,
just personally that that got me right there.
mm,
That was a beautiful answer. Thank you.
mm.
We've got just over 10 minutes left.
Beautiful. Well, so as I mentioned, there's all sorts of resources out there. I'm sure you've all got a bit of a list somewhere. One of those wallet cards or something, or if you haven't, just make one. Just put a piece of paper in your wallet or put a few numbers in your phone. There are actually apps. There's an app. I'll look up the name of it where you can actually get a script for texting and for asking questions. If you're worried, if you're worried about a mate who's interstate or something like that, and you're not quite sure how to check in with them, there are scripts for how you can have that conversation. I'll try and find it before we finish. But there's a couple of obviously the big ones online there. And again, Lifeline's got a great service directory if you're looking for other other supports. And that directory would go to all sorts of, the diversity of supports that are needed, not just mental health. It would be relationship support, uh, etc. So this app is called Prevent a Suicide. Uh, it's in tough times. Yeah. And it gives you text messaging, um, which you can either use, as part of a conversation over the phone or face to face, or if you are interstate and or not in the same space. So there's lots of other apps. There's apps for making safety plans put together by Beyond Blue. I think actually Lifeline own it now. It's called Beyond Now. Lots of resources out there. So That's pretty much me. I'd love to take any other questions. Glenn, I'm not sure if you've picked up anything else in the chat. Um,